All right, welcome to week 3. This week talks about BMI and fat versus muscle. So with the Wellness Rewards program, we use BMI to see where you are in the continuum for your age group and your gender. And so basically BMI is just a height to weight ratio. We really want people to be somewhere between 18 and 25, but the company says they'd like you to be under 28. If you're over 30, you're in the obesity range, and if you're over 40, that's morbidly obese. So you can simply look at your biometric form, if you have a copy of it, and see what your BMI was at your last screening. So BMI is a reflection of how much body fat you have. This is 5 pounds of body fat. Every pound of fat is worth 3,600 calories, and that's how much that you have to burn to lose 1 pound of fat. So you times 5 pounds times 3,600, and you can see how many calories you have to burn through dieting and exercise to actually lose 5 pounds of fat. If you look at 5 pounds of muscle, 5 pounds of muscle is a lot smaller, it's more compact, and it burns calories just sitting on your body. So don't ever think that weights make you bigger, it's food that's making you bigger. So ideally you want to do what? Some resistance training and some cardiovascular work and some dieting in order to what? Lose some fat and gain some muscle.
So from a global health perspective, the concept of the BMI is more important nowadays because we're seeing literally a growing problem, no pun intended. So the whole thing about weight is related to health. If we talk about the specific problems, you've all seen this before, you've all seen the problems that come from weight. Starting head to toe, you can have trouble with mental clarity, you can have trouble with confusion related to sleep apnea, you can have endocrine problems like thyroid disorders that are impacted by your metabolism, you can have trouble with respiratory problems from carrying around too much weight. Heart disease, of course, is one of the common ones that we know about that's talked about as a global epidemic nowadays that's related to an increase in BMI and weight. Specific types of cancers, in particular colon, breast, as well as some gynecological cancers, can also be related to an increase in our BMIs over time. Diabetes is rampant. That's another major issue that we talk about in terms of the health implications of obesity. And then getting to some of the psychological complications of obesity, there is a tendency sometimes for people to be withdrawn, to be isolated socially, and to allow depression and other anxiety or mood disorders to play a role in their weight and how that weight is controlled. So those are some of the issues that we talk about when we talk about weight in the clinic setting, is to try and figure out how we can improve those outcomes by talking about weight.
Some muscle. So muscle is metabolically active, meaning it does burn calories all the time. Fat just kind of sits there. So that's kind of the take-home message. And if you would like to actually have a body fat test done, the Well Coach does a 9-site body fat test, and I'll be glad to tell you what your body fat is. So please join us and stay tuned next week for our next tip. Thank you.